So guys, today we're going to be talking about Ideal Implants, and I have Bray here, and Bray works for the company and he's going to educate all of us more about the implants.
Terrific. Good morning. Thanks for joining Dr. Aga and I this morning, and board certified plastic surgeon up here in Newport Beach, one of our finest. Happy to be with you today and talk a little bit about Ideal Implant. So Ideal Implant is a structured saline implant. It has two distinct lumens. The posterior lumen provides a foundation for the implant to interface well with the chest, and the anterior is adjustable, so you can find different types of projection within the same implant. Over here we have a full projection Ideal Implant, and you can see how beautiful and handsome that anterior projection is. The Ideal Implant features some internal architecture which helps maintain the form stability of the implant and resist pocket pressures.
So Bray, why don't we cut one and show people what we are talking about with regards to lumen?
That sounds terrific.
Let's destroy one of your implants. Yeah. There you go.
All in the name of education, everybody.
Yes.
So we're just going to take a quick cut here. And what this can allow us to do is get an inside view of the architecture inside the Ideal Implant.
Can you open it up for us?
Absolutely. So along this lateral border, you'll see that there's a series of nested shells. Each of those shells will have some baffles in between each one. And what that helps to do is mitigate a lot of the sloshing that you can get from the original saline design. So this is an old school saline implant without structure, and patients that are active can hear this sloshing about, and that is something that does not feel natural to them.
They always hate that whooshing sound.
The Ideal Implant, even at a minimum fill, which doesn't project as much, does not create any of that sloshing.
And that's because the saline is within multiple implants. Essentially, this is an implant within an implant within an implant.
That is correct.
In a sense.
And what's also a nice benefit of that nested shell technology, which takes place around the perimeter of the implant, is that as this pocket produces force down onto the implant from the subpec placement, this footprint of the implant stays much more consistent under that pressure. Here we have a very projecting high-profile gel implant, and watch what happens under pressure. It really wants to squat down. So when we look at our superior safety numbers in terms of capsular contracture, we think a lot of that has to do with the form stability of the Ideal Implant and helping to mitigate that risk. And speaking of that risk, it's about a half to a third of what you find with gel. And capsular contracture is the #1 cause for reoperation in patients, and to help lessen that risk is really a part of our mission to make sure that patients get the best in outcomes.
Yeah. And then let's talk about the rippling, because one of the problems with using saline, the old style saline implants, which is this one, is all the ripples that you see on the sides, especially in a thinner patient.
Yeah, absolutely. You can see some of that scalloping and wrinkling and rippling here. And that's because you're relying on one very thin shell here to maintain the structure of the implant and hold the volume. When you look at the perimeter of Ideal Implant and you hold it here, you can see how consistent that is. And that is because we have that series of nested shells inside the implant to provide that support.
Right. And how about with silicone implants?
Even with silicone implants, you're doing pretty good there. But
yeah.
I think where we leave something to be desired is on this upper pole. So as the implant sits here, you see we have a nice shelf that's created. Mm-hmm. This is often referred to as the ashtray effect, the ability of the implant to kind of flatten out on the top. Right. And that's where the patient wants the most projection, is in that upper pole. Seeing it with Ideal, you see how it maintains that much more effectively. You don't get quite that shelf impact there.
Great education. Thank you.
Thanks for having us today, and thanks for choosing Dr. Aga and Ideal.
Thank you.